Welcome to the Center for Transforming Health podcast interview program, Your Health and Wellness. I am Leilani Stewart, manager of Center for Transforming Health, a new and innovative medical practice located in Keego Harbor, Michigan. Dr. Patricia Schmidt, or Dr. Pat as she is known to her patients, is a doctor of osteopathic medicine and is chief medical officer, owner of the Center for Transforming Health. She will talk with Mario Nanos, co-owner of Residential Home Health in Troy, Michigan, on today's program. Mario is a passionate advocate for patients with chronic medical conditions. He specializes in helping individuals with neuromuscular disorders and pain management. Mario frequently collaborates with Dr. David Simpson, medical director of the Muscular Dystrophy Association, an ALS clinic which is held weekly in the Michigan Institute for Neurological Disorders building in Farmington Hills. Welcome, Mario. Dr. Pat?
Thanks, Lonnie. It's great to have you here, Mario.
Good to be here.
Mario, will you tell us a little bit about residential home care? What's your mission? Where are you located? And what patients are you serving right now?
Residential home health care is based in Troy, Michigan. We are the largest home care agency in the state, as measured by Medicare. And our mission is to provide extraordinary care to our patients, prevent readmissions, work with hospitals to safely discharge patients home, and then once they're there, help physicians take really good care of those patients and keep them out of the hospital, which is where everything's heading these days, is to keep people safe in their homes.
That's great. Could you elaborate a little bit more about how you work with physicians?
Typically, patients are discharged from a hospital after an extended stay, or could be a short stay. For example, if an elderly patient fell in their home and they had to be hospitalized for a day or two or even a week, upon discharge, that hospital would contact residential home health care and fax us a referral to go into that home and make sure that we help that patient recover from whatever caused them to be in the hospital. And we will get that referral from a hospital, but we have to get an order from a physician to provide that home care. And that order could constitute providing care in the form of nursing visits, physical therapy, occupational therapy, speech therapy, and those kinds of things.
So for residential to be of assistance to the physicians, it's basically to see how you can be the eyes and ears and hands of that practice in the patient's home. Is that correct?
That is 100% correct. In fact, one of the things we do when we're in front of physicians is to use that, to coin that phrase you just used. We are the physician's eyes and ears in the home. One of the primary reasons why patients are readmitted to a hospital once they've been discharged from a hospital is for med reconciliation errors. So what we do is we will go into that home, and the first thing we do is take a look at what the discharging physician, the doctor is going to sign our home care orders, what he or she wants the patient to be on from a medication perspective. And then we will go into the home and look into the patient's med cabinet and determine, all right, so the doc wants this, you've got this going on in your home, and then we will reconcile those two kind of lists to make certain that the patient is taking the medication that the physician wants. And I can tell you that we oftentimes find errors. Patients will have meds in their med cabinet, or oftentimes a shoebox or a pillowcase. We find these meds in the homes that the doctor had no idea were in the home. And so when you say we are the eyes and ears of the physician in the home, that is literally, we are the eyes and ears of the physician in the home. Then we'll contact the doctor and make sure that everybody is kind of in the rowboat, rowing in the right direction, which is to keep the patient safe.
So patient safety is a really key thing. Do you have any connections with the private home care organizations as well? Do you collaborate with any of the non-skilled home care agencies?
In fact, we do. While we don't provide private duty assistance, we oftentimes collaborate with private duty home care agencies in order to get that sort of care in the home. I just had a family call me. We were providing skilled care in the home, and they noticed that both mom and dad were not doing as much as they used to be doing. and that things were falling behind, like the laundry. They noticed food in the refrigerator was kind of old, and they called me and said, could you please turnkey getting someone in here to help? And then I went out and made a few phone calls and brought in a private duty agency to collaborate with us to make sure that everything was going well. I have been working the last 10 years with the Muscular Dystrophy Association ALS clinic, which is held at MIND. And the acronym stands for the Michigan Institute for Neurological Disorders. They're on Orchard Lake Road in Farmington Hills. It's held in that building every Tuesday. I'm part of that multidisciplinary team, and Dr. Simpson heads it up with assistance from Maggie Siegel. We have a great team of people there. Dr. Michael Nigro founded MIND many years ago, and that's how I got introduced into neurology. And since then, residential has expanded into providing care for not only ALS, but many other movement disorders, Parkinson's. We already mentioned ALS and other neurological disorders, cerebral palsy, multiple sclerosis, and of course, muscular dystrophy. So yeah, it's an area in which we specialize, in which there's a lot of need.
Absolutely. I know that we've had the opportunity to share some home visits together with individuals with neuromuscular disorders. And that's always been really an important aspect of care for me, to go to the home and help people be as independent as possible. And I see that you do that with residential. I think we're also seeing that healthcare is kind of changing in general. Do you want to provide us some of your thoughts on just the healthcare, keeping your fingers on the healthcare pulse at this time?
I can tell you that the way that it's changing is that everyone in the healthcare system is going to be held accountable for outcomes. And I know it sounds crazy that why weren't we held accountable before? I mean, I held myself accountable for trying to make certain that every time someone is under our umbrella of care, that we're doing our best to help those patients. But what's driving this change in viewing things is that we realize that patients are readmitting to the hospital at alarmingly high rates. And that's not good. And that's also very expensive. And so the government has put in place measures to try to curb those readmission rates. And one of the ways that they're changing things is to say, if someone readmits within 30 days from the day that they are discharged for the same reason that they originally discharged for, the government's not going to pay that hospital for the care they provide on that second visit back to the hospital. You know, they want it done right the first time.
I think that leads us to looking at how do we prevent in terms of health and wellness. What are some of your thoughts on preventive medicine?
Well, I think that one of the things that you can do is to catch problems upstream. And the way you do that is you go see your doctor often, like the reason we're here, the place that you've got, Dr. Pat. The thing that the government's trying to prevent and that everybody has to stay keenly focused on, and, you know, in my own family, my father was using the ER as kind of his primary care doctor. And whenever my dad would have an ache or a pain, or I remember my father recovering from some surgery that he had, and 2 weeks post-surgery, when he should have been contacting his primary care doctor, he just went to ER. And that is exactly what the health system doesn't want you to do. They want you to get to your doctor, especially if you've got a chronic illness like congestive heart failure or COPD or Parkinson's disease or any of these other things that you've got going on that require attention. They want you to get to your doctor and make certain that he or she is on top of these conditions and has them under control, so that you aren't visiting ER 30 times in 1 year. There are patients that we come across all the time who are in the ER once a week, you know, and do the math, 50, 60 times a year. I remember reading one of the health systems had somebody in there a couple hundred times in their ER. And those are patients that are earmarked by those hospital systems as needing extra attention to curb that use of resources and to stop using the ER in that way. So the goal is get with your doctor, your primary care doctor, or someone like you, Dr. Pat, to make sure that you are keeping these chronic diseases in check.
Thank you, Mario. You have the opportunity to see a lot of different physician offices and medical practices. So, really looking at the whole person model, are there any models of care that you believe are really growing out in the private sector at this point?
I do. I think that the one thing that this type of healthcare system is driving is for physicians to get more personally involved in the care of their patients. And the unfortunate thing is that oftentimes the odds of a physician being able to spend the quality time with patients that they need in order to prevent these types of chronic diseases from putting patients into the hospital, they just don't have the time to spend. And so what I see cropping up are physician practices that have a lower ratio of physician to patient that allow physicians to spend a whole lot more time with patients and stay on top of these diseases. And I think that's kind of what you're trying to do with your practice, Dr. Pat, as well as many of the other physicians that I work with closely who are staying ahead of the curve.
I think that that's what we strive for here at the Center for Transforming Health, is to have that individual doctor-patient relationship and to really explore what can be the barriers to care and how we can help someone reach their highest health and wellness. I know you mentioned before that you go to extraordinary lengths to help your patients. Are there any stories that you'd like to share that you've had recently with any patients and families?
I just had one the other day, and I first want to say that I'm not the only one that tries to go above and beyond at residential to help patients in need. I mean, we try to get everybody on our team to realize that in some instances, we are all that our patients have. Do whatever we can to help keep people safe in their homes. And along those lines, I just had this case just a couple days ago where I got a call. We had a patient who told us that she had a snake in her home. Of course, I'm not going to send my nurse into a home with a snake in it. And we've all read stories about people who have snakes and leopards and tigers and monkeys and whatever in their homes. So I thought, I got to get out there and see what I can do. So just a couple days ago, I went to the patient's home. And prior to going to the patient's home, I called her to verify that there was, in fact, a snake in her home. And the patient replied back to me that not only is there a snake in my home, but I got two of them looking at me while I'm talking with you. So that prompted me to stop at a hardware store and buy gloves, a bag, and some other snake paraphernalia things that would keep me safe while I was grabbing the snake from her home. To try to wrap this story up, I went to the patient's home. Her grandson was there. He told me that his grandma, my patient, had a dementia problem and also thought that snakes were in her home when they truly weren't. So I went through the motions with my patient pretending to capture a snake so that she would feel a whole lot safer in her home. And after I put the imaginary snake in the sandwich bag, she felt a whole lot better, and I was able to get my nurse there to start working on her chronic condition. So we do what we have to do to help people whenever they need us. That's my snake story.
I think that's a great story because it really represents what health is about. It's going that extra mile. It's about having some humor, meeting people where they're at, and being respectful in all ways so that we can really create an environment to help people be the best that they can be. Is there anything else that you would like to add to this conversation that we haven't touched on?
Yeah, and there's one more story that I work with you on if I could share it. And it does involve palliative care. And if you remember, I got a call from somebody that I had graduated with years ago in college. Her mom, she was in a lot of pain. And whenever I hear pain or uncontrolled symptoms, I think palliative care. And the minute I have somebody talking with me about that, pain or symptoms that are out of control, I think of you, Dr. Pat. So I called Dr. Pat and I explained the situation. And you went out to this patient's home, worked with this patient. And this is the patient, if you can recall, that had the floating screw in her hip. And, you were able to work with her. She went back to an orthopedic surgeon, got x-rays, but my point is you were able to work with her. She did have some revisionary surgery done to remove that screw from her hip, but you were able to bring a whole lot more to the table to get her pain under control. And I know she's doing a lot better now.
Thanks, Mario. That's a great story. I appreciate sharing that. What we're looking for is from Center for Transforming Health and also from residential home care is to really look at how we can work together as a team, that it's not just a doctor-patient relationship. It's really a healthcare team that helps people reach their highest health and wellness.
It is exactly that. It is a team effort, and it's the doctor, the physician, it's home care, it's the hospital, it's a private duty, it's the infusion company. Therein lies the challenge. There are so many moving parts that keeping everybody connected can sometimes be challenging.
Well, thank you, Mario, for being with us today and especially for sharing those two great stories. I appreciate professionally and personally collaborating with you and residential home care. Thank you so much for what you do for families and patients in southeastern Michigan, especially with those individuals with neuromuscular conditions.
You're welcome. And, I really enjoy working with you. I think the main reason I do, in fact, I know the main reason I do is you really care. And sometimes care is the best medicine you can provide to someone who's sick.
Thanks, Mario. So appreciate your comments, and we really appreciated having you on today. Lonnie?
And thanks to you, our listeners. If you would like more information about residential home health in Troy, please call 866-902-4000 or visit their website, residentialhomehealth.com. For more information about the Center for Transforming Health, please visit us at www.ctransformhealth.org or call 248-481-7287. We at the Center for Transforming Health are all about helping patients to reach their highest health and wellness. But before we sign off, I would like to remind you to learn from yesterday, to live for today, and to hope for tomorrow. This is Leilani Stewart for CTH's Your Health and Wellness.